Hi, this is Walt Medlin, and I'm just giving an executive summary of our information that's part of our discharge instructions. Welcome to the club. Whatever operation you had, you definitely want to follow those specific instructions. These are very general and not to override anything that you've heard directly from your surgeon or your nurse or any of your BMI caregivers. To summarize though, early priorities after surgery are pretty simple. We worry about preventing fatal blood clots by having you walk every 3 to 5 hours. We only want you to walk a few minutes. 3 to 5 minutes is fine. You don't have to overdo it or worry about cardio at this point. You don't have to worry about continually increasing in that first week. It's just the basic movement to get your leg muscles moving. Now the little squeezy stockings are a substitute for when you're in bed asleep at night, but they're really not a replacement for just doing some walking. You want to be careful if you feel weak or dizzy. Don't go any further than you feel capable of, and be ready to sit down if you suddenly run out of gas. But it's not something, again, that we can really do for you. You do have to walk. It's not going to be easy. Your nurses sometimes are a little pushy for that, and that's okay. That's what they're there for. That is their job. So one of our second early priorities is to prevent a fatal pneumonia or a problematic pneumonia. Again, by getting you walking. Being upright really helps you take a deep breath. We do want to keep your pain under reasonable control. We're aiming for a pain level under 6, really. We're not going to make the pain level 0 for the first couple of days, but we certainly want to minimize it. Don't refuse your pain meds. Certainly expect that you're going to need to take pain medications, including Tylenol. Tylenol can really be helpful as an accessory to those stronger meds, and it really can give you additional pain relief. So don't just turn your nose up at the Tylenol. It's there to help. Don't over tighten the abdominal binder. It's there just for comfort. In fact, I, less than my partners, don't mind if people have it completely off. It's not holding your guts together or anything like that. So you just want to be comfortable. You don't want it to impair your breathing. We want it to help you feel comfortable taking a deep breath. Now, early on, especially the first couple of days, but even the first couple of weeks, you need to expect some nausea, some cramping occasionally. That's why you take small sips of fluid at first, and you give each sip a minute or two to empty downstream. When you get home in particular, people worry about wounds. Don't worry if there's a little bit of redness for less than a quarter inch around all of your wounds. That's sort of normal healing response. But if you have bright redness more than a half an inch away from the edges, especially if it's spreading or changing over time, that is something to let us know about, or to track or to mark the edges with an indelible marker and make sure that it's not growing. Don't be afraid to get these things checked out, but it's not always a panic situation. Expect to have some yellowish or yellow-red fluid for several days. The large incision is going to feel sore for quite a bit longer than the smaller incisions, and the one directly in the middle under the xiphoid process under the breastbone, that one tends to be sore for longer than the other ones. That's not unusual. If something changes, again, you do want to get it checked out, but don't panic. In terms of why people get readmitted to the hospital, it's actually usually dehydration, and the hard thing there is to remember to start early every day and to set goals and to track things and really make sure that you know what's going in so that you don't accidentally fall behind. If somebody is really dry for 2 or 3 days in a row, that can be fatal, but even more often it's just problematic and people end up feeling really bad and having to come in just to be in the hospital for IV fluid and observation. If we can avoid that, obviously that's better for you and your family too, if we can avoid unnecessary hospitalizations. That's the basics. So I want you to read your program information over again, and make sure you have your medication plans ready for home. Go back over the PDF file or the data fob from Andrea. Make sure things make sense to you. Make sure that you have some sugar-free popsicles at home or some Crystal Light, that you have fluid available, and that you have all sorts of different options. You don't have to have a ton, but at least have a few options. A lot of people, water tastes a little weird to them and they just need to treat it a little bit. You don't want to add sugar to anything, but there are a lot of things you can do to flavor. Don't worry if it's a few days before the protein shakes go down well. They're a bit thick, and some people really do feel like it tastes a bit strong, or that it's just a bit too sticky. You're not going to run out of protein in a few days. In the long term, that's a priority, but first, for this first week, fluid is really far more important, just to get those clear fluids down. Now, you need to expect very low energy for the next week and low-ish energy for the next month. Be very careful, especially with driving. If you have a car crash because you were driving when you shouldn't have, we can't undo that. If somebody else gets hurt, we can't fix that. So really be extra careful. Even for the next few months, your energy is not perfect. Another issue people have sometimes is that expectation, or they're worried that they're terribly constipated because they're not having regular bowel movements. It's very common usually to have just a couple of bowel movements in the first several days after surgery, sometimes even just one that first week. Be ready if you need to take some milk of magnesia, but mostly it's from people being dehydrated and just not having much stuff to come through, so don't panic if you're not regular. Review the emergency instructions on your discharge instructions and go over it with the nurse as you will, and don't be afraid to go to the ER. If you feel terribly ill, we're not going to stop you. If you call and say, I feel like I'm dying, our only answer is going to be get in an ambulance and get to your nearest ER. So don't feel like you're bothering us if you have a problem. That's what we're here for. And just because you're out of the hospital does not mean that you're healed. The next 30 days in particular, we really can't take anything for granted. You're not allowed to really say, oh, I just have the flu. If you're vomiting, we need to assume it's a problem and prove that it's not, even if everybody at home has the flu. Have our contact information with you to share with any caregivers that you see in the next 90 days. If you go into an ER for a problem, we really want to be in the loop. We want to help those doctors provide the best care, even if you're not able to make it all the way into Salt Lake if you live further away. We're definitely available and we want to coordinate care, but sometimes that takes the patient being a little bit pushy just to say, please call my surgical team. And that really goes forever too. You're always allowed to have your primary care doc get in touch with us or any specialist you see if there are special questions. Please don't feel shy about giving them our contact information because we like to make sure that things don't fall between the cracks, and we are specialists, and so we don't expect everybody to know everything we do. A lot of folks know a lot, and that's great, but we also like to know how you're doing. So please don't be shy. This first 30 days, just don't be shy, but don't panic. It's a bumpy road, and knowing where the emergency criteria are and what the main priorities are will help you do your very best. Well, good luck, and I hope this is helpful.